All right, here we go. You guys can see the screen, correct?
Correct.
All right, this is where Lieutenant Tonelli said he left off yesterday.
Yesterday was Sunday. Yeah.
Monday, Friday. So he left off Friday.
Are you trying to present the screen?
I'm
Chapter
over
30.
there, but I'm in TCD.
Chapter 30, this is where you guys left off on Friday.
Are you trying to present the
All
screen?
right. Can you not see the screen?
No, we can only see this through the whiteboard or the smart board. We can't see it presenting.
Okay, thank you. You're good now?
There we go.
Okay.
Yeah.
Thanks, Kevin. All right, so how are we going to take care of these emergencies? Scene size up, right? So scene safety, make sure that it's safe for you to be there. Call for additional resources. So when you guys are testing with your NREMT exam, call for additional resources early. If you believe that this is an ALS call, that it's not BLS, you need that paramedic service, then go ahead and get that ALS rig coming. You're going to look at the mechanism of injury and the nature of illness, and then always consider injuries with a mechanism of injury could have, what could it have produced? Perform your rapid exam. That's your 30-second to 1-minute exam. You're looking for any immediate life threats. Profuse bleeding, airway, breathing, circulation. Form your general impression. Don't be distracted from the obvious injury. So if Jimmy's got a finger that's bleeding, don't just hone in on that because he's also got a blood sugar of 30. So don't get tunnel visioned. Make sure that you're looking at the big picture. And then always address any life-threatening external hemorrhage. So anybody that's bleeding, anybody that has external bleeding that's severe, you're going to go ahead and take care of that right away, right? Because we have to have volume for the blood to circulate to get perfusion. That's going to be done before airway and breathing. So when you see these exam questions, the NREMT likes to put these on there. So they're going to put, what is your highest priority? And then you're going to have a person that's profusely bleeding and maybe not breathing. So what's your highest priority? It's the bleeding first and then the not breathing. It's the bleeding first and then the not breathing. Okay. Always ensure that the airway is clear and patent so they have an open airway, they're breathing. Make sure the circulation, there's no profuse bleeding, and then treat aggressively for shock because what's the shock that they're going to go into if they're profusely bleeding? Hypovolemic shock, and it happens quickly. So if they're bleeding out, you only have 6 liters in the body, they bleed out 1 liter, they're going to start showing signs of shock. So treat that aggressively. Is that ALS or BLS? ALS, good. So get that ALS vehicle coming. And then make your transport decision. So abdominal injuries are most often a quick transport to the hospital. There's not a lot we can do with abdominal injuries. Anytime anybody's bleeding internally, there could be major bleeding in the stomach, liver laceration, a spleen that ruptures, appendix that ruptures, kidneys that are bleeding or ruptured. So car accidents, any type of trauma can cause all of this. And where is that organ going to bleed? It's going to bleed into the belly. So when you see this bruising noted to the abdomen, or you see the abdomen getting bigger, that person needs to get to the hospital. It's a true emergency because they need surgery to fix it. With your history taking, you're going to clarify the chief complaint and the mechanism of injury. So note the position of your patient. If the patient was driver restrained to the vehicle that hit the tree at 80 miles an hour, you want to document that the lap belt was on, that the patient has, their abdomen is distended and rigid. Well, there could be internal bleeding going on. Use your sample history and then ask if there's any nausea, vomiting, or diarrhea. Real important. Ask if there's any blood in their urine. Ask if there's any blood in their bowel movements. What does it look like? Is it black and tarry? That lets us know that they've got internal bleeding going on. Blood in the urine. So if they tell you, you know, when I go to the bathroom, I actually have blood when I go to the bathroom. That could let you know that, hey, they've got bruised kidneys, they've got a kidney laceration, there's something going on with their kidneys. And then that black tarry stool. So if it's really black, tarry, and stinky, that is dried blood. So that's blood that's bleeding, that's getting into the colon, okay? With your secondary assessment, you may not have time to complete it, right? We talked about that. So you're going to do your secondary assessment in the back of the ambulance while en route to the hospital. You may not have time to complete your secondary exam. So when you get to the hospital, just let them know that, hey, this is how far we got. We did a rapid transport. We weren't able to get the secondary assessment completed totally. On your physical exam, you want to do your inspect for bleeding, inspect the entire abdomen. So if the person's telling you, hey, my left upper quadrant hurts, what's the first part of the abdomen that we're going to palpate? Remember this?
The quadrant before the quadrant after the injury, so then you can palpitate around, so then you can move towards it.
You are absolutely correct. Everybody hear that? All right, so we're going to palpate lower, upper, and then get to the part that hurts. And they're going to tell you, as soon as you touch that on palpation, that's where it hurts. And then we know through our chapter 6 anatomy, we know what organ is going to be underneath there. So that's what we're going to suspect is injured. And then use your DCAP BTLS. D for deformity, and then go through your DCAP BTLS. Make that cheat sheet so that way at 2 o'clock in the morning, you can remember what DCAP BTLS is. And that's just going to keep you more organized. So for you, those of you that have started doing your clinical time, you're starting to get into the field, you can see that the paramedics and the EMTs, they're doing this, right? So that way they're not missing anything. So just like Natalia said, we're going to palpate the quadrant farthest away from the quadrant exhibiting signs of injury and pain, and then work our way around. We're going to perform that full body scan, so don't miss anything. Make sure you're log rolling. Make sure that you're looking at the back. So you're not only looking at the front of the body, you're looking at the rear of the body. Looking for bruising, distension, any signs of internal bleeding. Inspect and palpate the kidney area for tenderness. Where's the kidneys? Where are we going to palpate that? Where? Okay, the flank area, right? We call that the flank area. So it's towards the back, but it's on the sides, on the left and right side. You want to palpate that. We're looking for any bruising over the kidneys. We're looking for any swelling over the kidneys. And that lets us know that they got problems going on. We want to get our baseline set of vital signs in our secondary assessment: blood pressure, pulse, respiration, pulse ox, temperature. That's the sheet that we're doing for extra credit. That's due on the 8th. So we're doing our vital signs. You're going to record your vital signs, and you want to note any changes. So in a high severe patient, if it's a high category, we want to go ahead and do vital signs every 5 minutes. If it's a lower priority patient, we can do vital signs every 15 minutes. But you're going to look to see if there's any changes. So if my first blood pressure is 120/80, and in 5 minutes, my second blood pressure is 80/40, what's that telling me? Is that
What
good or
was the
bad?
first one?
So the first blood pressure is 120/80, and the second blood pressure is 80/40.
Oh, that's going bad.
Yeah, right? So that's bad. So they're starting to get shocky. There's a reason why their blood pressure is dropping. And 9 times out of 10 with the abdominal injuries, it's because they're bleeding internally. So there's internal bleeding going on. If the mechanism of injury suggests an isolated injury to the abdomen, then we can focus our exam on just that injured part. But if the mechanism of injury, if you've got a high rate of speed with your car accident, there's a lot of damage to the car, we have to suspect that there's multiple injuries. Can't harp this enough. You're going to repeat your primary assessment You repeat your vital signs every 5 minutes with your critical patients. So if it takes you 20 minutes to transport, you should have 4 sets of vital signs on your patient care report. And then make sure you're doing a good patient care report. Make sure you're documenting what the patient is complaining of and what you find, and also your pertinent negatives. Remember, we talked about pertinent negatives, meaning you're going to document the things that are not, they're not complaining of. So with abdominal injuries, patient is complaining of left lower quadrant pain. Patient has bruising to the left lower quadrant. No distension, no rigidity noted. So if I put no distension, no rigidity, that's a pertinent negative. So that's pertinent to the abdomen that we're assessing, but there's nothing that we found in that area. Closed abdominal injuries. The biggest concern here is not knowing what is the extent of injury. So how bad is the liver lacerated? How bad is the internal organ damaged? That's what we don't know. So that's why we need to do a rapid transport with abdominal injuries. We have a lot of stuff in the abdomen, right? There's a ton of organs and stuff packed into there. So if one or more of those organs are damaged, we're not going to know the extent of it until the person is taken to surgery. So that's what they ultimately need, is the surgeon. So we're going to do rapid transport to the nearest hospital for care. We're going to put the patient in position of comfort. So on the cot, we're going to have them typically sitting up. However, if the patient tells you, I feel better when I'm on my side, and I feel better if I bring my knees to my chest, sometimes it takes the discomfort out of the abdomen. So go ahead, and it's okay to transport in that position. So we're going to put that patient in the position that is most comfortable for them. What's the drug that we're going to give them? The drug therapy? We're going to give them oxygen. So high flow oxygen, if signs of hypoxia or shock. 15 liters, non-rebreather. What is our pulse ox going to be if we're starting to see signs of hypoxia? Below what number? Below what? Yeah, below 92, below 90. We're going to see pulse ox in the upper 80s, and that just means that they're not perfusing. So they could be bleeding internally. If there's not enough circulation, there's not enough blood to circulate, we're going to start to see that signs of hypoxia. You get someone with blunt abdominal injury, always make sure that you log roll them and check the back. Backboard and seat collar, if you suspect head, neck, or back injury along with the abdominal injury because of the mechanism of injury, protect the spine and then monitor the vital signs. If you have an open abdominal injury, these get a little tricky. So if you have an evisceration, so patient is in a car accident, and because of the mangled metal in the car, it actually penetrates the abdomen and causes the organs to come out of the body. Those are a little trickier to deal with, right? Because now it's not bleeding internally, the organs are actually outside the body.
Is that considered internal? I was about to ask, is that considered internal or external? Because technically it's open, so it's external.
Correct, so it'd be external. Yeah. So we're gonna cover that with a moist dressing. Don't put it back in. Yep, leave it out. So if the organ is out, we're gonna go ahead and leave that, and then we're gonna do a rapid transport because that person is gonna need the surgeon to put the organs back together. Always have your high index of suspicion that just because the organ is outside and we can't see any bleeding externally, there could still be bleeding internally though. Always inspect the patient's back and sides. Now this is when we're pertaining to gunshots to the abdomen. There could be an entrance wound into the abdomen and there could be an exit wound in the back. So always make sure you're looking at the back, especially for our gunshot victims. And with gunshot victims, when people are shooting, they don't know, they're not aiming when they shoot. So they're just shooting. And I think more of not, people will take abdominal shots that I've had over the years than anything else. They get shot in the abdomen. So it goes in and it causes the damage in the abdominal cavity, and then either the bullet exits or the bullet stays in. So that's something to keep in mind too. There's your evisceration. So severe lacerations of the abdominal wall could result in internal organs or fat protruding through the wall. So the intestines actually come out of the body. No, that would be his intestines.
Where is the TCD?
Yeah, for real.
Where
I
is the
see.
TCD?
Yeah, excellent. I love it you guys pointed that out. So make sure you have full PPE, right?
They do that at my doctor's office too. I don't wear gloves ever. Like they get shot multiple times.
Right? Right? You could always request that they put PPE on. But for these pictures, they're staged, so you won't always see full PPE. The organs, here's the takeaway. Highlight this, you'll see this again. The organs should be kept moist and warm. So moisten your dressing, direct pressure like you see he's doing there, and then go ahead and get that bandaged. Yeah, just saline.
How do
Go
you
ahead.
keep it warm?
Yeah, body temperature, blankets. So you're gonna go ahead and dress and bandage it, and then you're gonna put the patient, put a bunch of blankets over so he maintains his warm body temperature. You just don't want that organ that's outside of the body to be cold.
Okay.
Yeah, so I've had a couple of eviscerations over the years. They're painful. Yeah, it's the organ is out. It looks really bad. But it's easy to fix for the surgeons. So we just basically package them up, get them to the hospital. They go in and open up the abdomen, and then they put everything back to where it should be. They clean everything up, and then they're going to sew, close the wound, and then they're going to put them on heavy-duty antibiotics because obviously anytime there's an organ outside the body, we're afraid of infection. So they're going to put them on heavy-duty antibiotics and then monitor them. And what they want to do is they're going to keep them in the hospital for at least 48 hours because they're making sure that there's no internal bleeding.
Your stomach was cut open, your large intestine was hanging out, but we're only going to keep you here for another day.
Yes. And then they monitor them and then they send them home.
Yeah,
But-
somebody like breaks their knee is going to be like for you.
But they're also going to tell them, hey, when you are discharged, these are the signs to look for. So if you start having any pain or any of this, and this, you need to recontact 911 right away.
What happens when you get, what does that lead to? Is it just like you got lucky because you got to the hospital fast enough, or is there any lifelong symptoms that you have because your organs are exposed out of your body?
Yeah, no, I don't. The patients that I've had with eviscerations, they've not had long-term problems. Obviously, in the short term, they worry about infection where they could become septic. But as long as they take their antibiotics and they're on that regimen, then the infection should not set in. But again, they have to make sure that the site is cleaned and the wound is clean as best they can before they close up everything. So they'll irrigate everything. They'll try to make sure that everything is as clean as possible. Because think about, these patients that this happens with, say, a car accident, there's nothing clean about the car. So the metal, that's causing this it's gonna cause infection. So you're gonna get an infection 99.9% of the time. That's what the antibiotics are gonna combat. You could also have, so say for instance, someone gets shot in the abdomen, you could actually have an evisceration. So it depends on the larger the caliber of the weapon, the more damage there's going to be to the abdomen. So that would be bad. So yeah, if you get shot with that. But where you're going to see, so your handgun injuries are going to be different from your rifle injuries. So that's why you see these, these mass shootings that are going on. A lot of these people will use the rifle because it causes more damage than a handgun versus like a 22. Yeah, so don't put the organ back in. Never do that. Try to just keep it keep it external, keep the organs moist and warm. Just use your sterile dressings. We're going to use our trauma dressing that's out of the back of the ambulance that's sterile. And then, you know, we just bandage that. You're just going to wrap that all the way around their abdomen and then secure it. Anatomy of the genitourinary system. This controls the reproductive functions and waste discharge. It's located in the abdomen. So that's your kidneys, your ureters, your bladder, and your urethra. Kidney injuries. Now, this is where you could have long-term problems. So we see this with either car accident traumas or even sporting injuries. So someone that's repetitively in, say, football or hockey, where they're getting hit in the kidneys, that could cause permanent damage. So that could actually cause you to lose a kidney. Can you live off of one kidney? Yeah, but
Yes.
it's very dangerous, right? Because now that's all I got to filter. So we really worry about the kidneys. If you lose both kidneys, then obviously you yes.
Wait, could you not have both kidneys and then go to dialysis every day?
Well,
It's technically still good.
yes. So you're put on, if your kidneys are failing, so they're working, but they're not working 100%. Yes, you can be put on a transplant list, but the problem is there's more people on the list right now than there are kidneys. So that's the problem. The female genitalia lie within the pelvic cavity. And then these injuries are rarely life-threatening. So highlight that, you'll see that. So these injuries are rarely life-threatening.
I just thought about this because it says urethra, and like if a man gets his, and it's not there no more, what do you do for that? What happened?
So you're talking about an injury?
No, like it's off. Like
His wife
Like-
finds out that he's cheating and just goes.
yeah, just like it's gone. Like it's off his body. Not connected.
So it's going to bleed. Okay, so you're going to have profuse bleeding. So the best thing to do is to take your gauze and have the patient, if they can, hold direct pressure. And then you're just going to bandage and dress that. And then they need surgery, right? So they need surgery to stop that bleeding.
What does it go back on?
Well, it depends. So in the case of, have you heard the big case that went national, which the Lorraine Bobbitt case? You ever heard of that? Okay, so if you've never heard of that, if you Google Lorraine Bobbitt, so she was the first one in the United States to do that. So she took a pair of scissors and cut that off, right? They were able to reattach. So they were able to reattach. So yes, they do amazing things with reattachments, with fingers and arms and limbs. Yeah. So, but he lived. He lived. He was able to call 911. He got to the hospital, and they were able to reattach that part. Is it possible? Yes. Is it possible that they can't reattach it? Yes. And in that case, they would have to do plastic surgery and some other things. You may not be able to have function of that, so you may have to have a permanent bag that you're going to urinate in. And then you probably will not have your reproductive part of yourself working. But there was more cases. She was the first that really made national news and this and that. But there has been several cases since then.
Well, I'm just cutting it off, but I mean, like, if you get an injury to that, since it's genitalia, isn't it just gonna bleed?
Sure, it's very vascular. Yeah, so that's why I said direct pressure, as with any other wound, direct pressure and get the person to the hospital. Yeah, there's nowhere to put the tourniquet.
Well, it depends on where you're gonna go.
Now that would be more of a high priority, life threatening because of the severe bleeding. So that's going to cause severe bleeding.
I mean, is there anything else with that, or
Bleeding, yeah, it's no different than cutting your finger off. So it's just going to bleed.
it's a little different.
I mean, it's a little different,
It's a little different.
but it's just going to bleed.
Would you rather get that cut off or your finger broken?
Me neither.
My friend had an engine fall on his finger over the summer,
Okay.
and it was 500 pounds. It was a 5.0 engine, straight on the finger. Harbor Freight did not do a good job with their engine stand, and it was hanging off literally by the ligaments.
Were they able to reattach?
Yeah, so they rushed into CDH. pH felt superior somewhere. Took him to Loyola in surgery, but yeah, couldn't move it a little.
Yeah, Loyola has a hand reattachment just unit that they work on. So they do amazing things over there. And you know, does he have function of the finger today?
Yeah, somewhat. Like it's there. It's like it is a pain. I'm just gonna cast it off.
Yeah.
So why can't they reattach bigger limbs? They can reattach your finger.
They can.
You would, no, I know, but like if somebody gets like their like if they get a bad enough injury to the arm, don't they just have to take it off most times? Like especially people that are you know like overseas in a war. I obviously like if something explodes next to you, it's different. But a lot of people like get limbs severely injured to the point where they have to be cut off. So
It depends.
Why can't they stitch your arm, which is a lot bigger, and I was assuming easier to stitch together?
It's harder.
So it's the vascular, yeah. It's yeah, exactly. So
When you have a finger, it's just like a few specific
It's like
muscles and like maybe small capillaries and stuff. But when it's an arm, it's like your like what's it? Radial arteries going through there, your muscles, trying to connect muscles so that they can still function, nerves that you can still feel.
and it depends how it was amputated too. So
Also,
if it
like,
was clean cut or not,
like almost.
right? Yeah, that's why it's tougher to
Like
reattach.
you could reattach all of those, but for everything to last as you're reattaching
Yeah.
is harder.
Yeah, well, true. And then if you reattach and you don't have any circulation, then
You know, this
it's just going to die anyway.
style.
It's just gonna rot.
Yeah. So, you know, you won't have any feeling, sensation, no circulation. So, you know, it's going to be, it's just, they're going to have to remove it. And then what they'll do is they'll remove it and then they'll put a stump. So that way it's capped off, if you will.
And how does prosthetics work in that case? People could still move there.
Yeah, so prosthetics today are they've come a long way. You can actually now function with a full arm and hand prosthetically, and you can actually function with legs and feet. There's those videos where you see that athletes are now running marathons with prosthesis. Athletes are competing at the highest level, especially in the Olympics for Paralympics. It's amazing to see what they can do with these devices, and they're computer driven, most of them. So it's somebody that's really smart that's making these devices so they can have a better quality of life. Yes, exactly. People that are a lot smarter than us because they're designing this stuff, right, Jimmy? All right.
Jimmy's not one of them.
All right, we're gonna go ahead and we'll stop here for today with the lecture. We got a good chunk of it. For you guys online, homework and quiz for this chapter is going to be due Wednesday by midnight. So you got a couple more days. So you can work on your homework, keep reviewing for your exam that you're going to take this week. And like I said, Kevin, you'll just take yours when you come back in class. You guys have any questions online?
None here.
Do they, so when people get in a crash and their, like, liver is out, or the intestines are out, do they feel their intestines when somebody touches it, or no?
Yeah. Oh, yeah. So the question is, you guys hear that? The question is if the say the evisceration, the organ is out of the body, can they feel that? Absolutely. And that's going to be, they're going to be in severe pain. A lot of times they'll start to become shocky and they may be unconscious. They may go unresponsive because of the pain is so intense.
Okay.
Yeah, good question. All right, you guys online, you guys have a good rest of your day. Stay warm. It's cold outside.